Here is the daily Northwest Training Development Team and Pathways Coronavirus Outbreak Update. Today's information is about the government's advice for people who are more at risk of becoming more poorly if they catch the virus. It's important to remember that most people who catch the virus will only have a mild illness. For most people, it will be okay for them to stay at home and take care of themselves until the illness passes. The government has said that there are some people who are more likely to become more poorly if they do catch the virus. These groups of people include everyone who is aged 70 years old or older, and anyone who is under 70 who has specific underlying health conditions. This includes anyone who is asked by their doctors to go for a flu jab each year as an adult. It also includes anyone with a learning disability. Those of us in this group of people are being asked to take extra care to keep ourselves safe. We should think about if it is possible for a friend or family member to pick up our shopping for us. Many communities are organising volunteers to help people who need to stay at home to get their food shopping and medicines. There is a smaller group of people who are even more at risk of becoming very seriously ill and needing to go to hospital if they catch the virus. These people include people who've had transplants like kidney or liver transplants, people who are having some treatments for some forms of cancer, people who have long-term lung disease, people who were born with some rare conditions that mean that they may be more likely to catch infections, people that are taking drugs to reduce their body's ability to fight infections, and people who are pregnant and also have significant heart disease at the same time. The NHS has written to everyone who is in a group most at risk of becoming seriously ill if they catch the virus. This is so extra steps can be taken to help stop them catching the virus. The government calls this shielding. The NHS letter may describe people as being extremely vulnerable. People in this group have been told not to leave their home at all for 12 weeks from the date they received their NHS letter. They should ask for their food and medicine to be delivered to their house and not go out to get it themselves. Friends or family members could do this, or online delivery services could do this. People delivering food or medicine should not come into the house but should leave it on the doorstep. The government has created a web page and phone number for people at most risk if they need help. The web address and phone number are underneath this video. Some people in this group will still need really important support with things like washing and dressing and eating, and this support should carry on. Extra care should be taken to keep people safe while doing this. If someone in this group develops symptoms of coronavirus, they should go to NHS 111 online or call NHS 111 straight away. They should call 999 in an emergency. It will be so important for these people to do things they enjoy and take care of their well-being while they're at home. Remember, most people who catch the virus will only have a mild illness. There are some people, including people with a learning disability, who do need to take extra care in social distancing because they're more at risk of becoming more poorly if they do catch the virus. There are some people who have been sent an NHS letter because they are most at risk of becoming seriously ill if they catch the virus. These people have been told not to leave home for any reason for 12 weeks. Finally, it's really important that all of us take care of our well-being and do things that we enjoy while we're being asked to stay at home.